So if you are studying for your NCLEX exam, you must know about SIADH versus diabetic insipidus. They tested you a lot of questions from this section. In order to understand, you must understand first this section. So let's go over. If you can understand this section, that's going to be easy for you to understand the other sections. So what happened normally, if you have a low fluid volume, then ADH is released. ADH is known as antidiuretic hormone is released in your body. That gives signal to your kidney that hold on to the water. Once it's happened, the fluid volume increase. That's the normal. So normal again, if you have low fluid volume in your body, then antidiuretic hormone released, which gives signal to hold on to the water because we don't have enough water. That's how the water volume increase. So now in SIADH, what happens? Antidiuretic hormone is released no matter what. Then it gives signal to kidneys, hold on to more water and more water. That's caused, if you have more water in your body, that will cause fluid volume keeps going up, then fluid overload can occur. If ADH is telling your kidney to hold on to more water, the fluid volume keeps going up, that will cause fluid volume overload. And in diabetic insipidus, what happened? You have low fluid volume. The ADH isn't released or the kidney don't respond to it. So the body read more fluids, which will cause fluid volume decreases or fluid volume deficit. So that's the basic thing. Now let's discuss about SIADH versus diabetic insipidus. So SIADH means symptom of inappropriate antidiuretic hormone versus diabetic insipidus. So in SIADH, what happened? As you can see, IADH means inappropriate ADH. When this happen, the ADH increase in your body. IA means increase ADH. So this is your given away. You will remember this. I means increase ADH in your body. So when in SIADH, ADH is increase. What is the function of ADH? Antidiuretic hormone regulate the amount of water in the blood. So if ADH increase, more water in the body. If ADH decrease, more water loss in the urine. So sign and symptoms of SIADH versus diabetic insipidus. So SIADH, just think you have too much soaked insides. That means too much water inside, soak inside. Versus diabetic insipidus means dry inside, DI is given away. So let's discuss what happened to urine output. So you will have low urine output of concentrated urine. On the other side, diabetic insipidus, you will have high urinary output of diluted urine. So when this happen, in urine specific gravity, which is normal is 1.005 to 1.030. In the SIADH, it's increase greater than 1.030. The trick to remember is concentrated urine makes the number curve up. And the diabetic insipidus, the urine gravity gets less than 1.005. Diluted urine makes the number go down. So D means diluted down. So let's talk about volume in the body. What happened? Fluid volume overload. If you have too much fluid volume overload in your body, it will cause water intoxication and weight gain. On the other side, fluid volume deficit. When body lose a lot of fluids, you will have more thrust like polydipsia and you will have increased thrust. You will have dry mucous membrane, decreased skin turgor. Let's discuss about vital signs. So in the SIADH, you will have high blood pressure because retaining water, that means so more volume, more pressure. On the other side, DI, you will have low blood pressure. Low blood pressure means hypotension. High blood pressure means hypertension. Low blood pressure because losing water, so less volume equal to less pressure. What happened to heartbeat? Heartbeat decrease in the SIADH because too much fluid in the body, so heart don't need to push more because there is already too much fluid, so heart don't need to push more. And the diabetic insipidus, what happen? You will have high heartbeat known as tachycardia because hydrate, so heart has to work hard to push fluid to your body. If your body is hydrated, the heart has to push more, so that's mean it will be having high heartbeat. So let's discuss about the sodium. So you will have hyponatremia, less than 135, less sodium because all water soaking sodium and it's appear low. Because all water soaking sodium, that's why it's appear low. On the other side, diabetic insipidus, you will have hypernatremia, means greater than 145 sodium level. Lack of water making sodium very concentrated, making sodium appears very high. So that's the overview of SIADH versus diabetic insipidus.